Since Palawan is classified as geographically isolated and disadvantaged area, medyo napaka-challenging ng delivery ng healthcare system sa Palawan.
With the number of population, medyo kumukulang ating mga doctors. Ang problema namin ngayon kasi kulang yung aming mga medicine. No?
Kung meron man, hindi rin maka-afford karamihan yung ating mga pasyente.
The Philippine healthcare system faces challenges as it moves towards kalusugang pangkalahatan. While the incidence of communicable diseases is declining, the incidence of non-communicable disease, however, is rising. As a result of this, the DOH has identified 3 strategic thrusts to achieve kalusugang pangkalahatan: attainment of health-related Millennial Development Goals, financial risk protection, improved access to quality hospitals and healthcare facilities. A key pillar to improving health services is access to medicines. To study these issues further, an appraisal of the health situation in Palawan was conducted by Dr. Ces Acuin.
In a nutshell, our findings from the baseline study were that access to medicines has different components or aspects. There is the physical availability of the medicine itself. Is it in the boticas? Is it in the hospitals? Or is it in the sari-sari stores? The affordability of the medicines, the cost of the medicines is not the only factor. The cost to access the medicine, to buy it from the botica if the person lives very far, sometimes will be higher than the cost of the medicine itself. And there is the acceptability of the medicines if people trust where the medicine comes from, whether it was produced of sufficiently acceptable quality. These are the important aspects that people look for in access to medicines.
In order to address this issue, the Palawan Access to Medicines project was established with the objective to improve access to health services and enhance the availability and affordability of medicines for hypertension, diabetes, preeclampsia, and childhood pneumonia. Its pilot project is Tulay sa Kalusugan, a public-private collaboration between the Department of Health, the Provincial Government of Palawan, the local government units of Puerto Princesa, Brooke's Point, Narra, Roxas and Coron, and major research-based biopharmaceutical companies MSD, Novartis, Pfizer and Sanofi. Several non-government organizations, medical societies, and academic institutions are also participating in the project.
Palawan was chosen to be the pilot site for the Tulay sa Kalusugan project because it is a microcosm of the situation in the Philippines. It has the geographic diversity of the country. It has urban and rural differences as well as rich and poor differences that are typical for the Philippines. And it has national and local government aspects that are typical for the rest of the country.
Tulay sa Kalusugan aims to support the achievement of kalusugang pangkalahatan in the Philippines by providing patients in the 5 pilot sites with more affordable, innovative medicines through participating government health facility pharmacies, health system strengthening activities such as capacity building for health workers to enhance disease management, simple information technology tracking systems to improve data collection, patient education and awareness campaigns.
The initial intention of the project was to address the issue of affordability. So the original idea was just to lower the prices so that people can afford the medicines. But the baseline showed that that would not be enough, because even if you lower the price of the medicines, if the cost to get to where the medicines are available is still high, then people might not be able to access the medicines either.
The project has a 2-year time frame, and its beneficiaries will be middle to lower income patients suffering from hypertension, diabetes, preeclampsia, and childhood pneumonia. Part of the health system strengthening activities is capacity building of health workers on maternal and child health and non-communicable diseases.
The objective of the training program is to be able to build capacity among health workers and this will include midwives, nurses, and doctors to be able to manage sick children from age 0 up to 5 years old, giving them appropriate management, if necessary, to refer them to hospitals or treatment in the outpatient clinic.
Kung matitrain po lahat ng mga health workers doon, siyempre, mga tao po sa amin, pagpunta na po sila sa amin, hindi na po sila mag-aalangan dahil meron na po kaming kaalaman at meron na rin po kaming mga gamot na ipapamigay sa kanila. At dyan pa lang, parang confident na rin sila na gagaling sila.
Our founder, George W. Merck, said that medicine's for the people. We cannot rest until the way has been found with our help to bring our finest achievements to everyone. Through the Tulay sa Kalusugan program, MSD will provide much-needed access to our innovative and life-saving medicines and vaccines to Filipinos who need it most.
Novartis helps promote progress in the Philippines through our key advocacies of improving access to healthcare and fostering research and development in the country. We are honored to be part of the Palawan Access to Medicines project, a groundbreaking initiative that aims to enhance patient access to healthcare, a long-standing commitment of Novartis and the Novartis Foundation for Sustainable Development.
Pfizer is dedicated to the improvement of human life and the battle against disease and disability. And as such, we support this project wholeheartedly.
We are honored to be part of Tulay sa Kalusugan. This is an important and unique public-private partnership to improve access to healthcare here in the Philippines. And one of the many ways we in the pharmaceutical industry continue to contribute to the achievement of Kalusugang Pangkalahatan.
We're really very thankful that you choose Palawan to be the pilot province. When this project starts, you can expect full cooperation of the Provincial Government of Palawan. This is the beginning of a very good program to improve the access to innovative medicines of our poor. Thank you very much.
So on behalf of the people of the Philippines, I wish to extend our deepest gratitude to the partners behind this incredible project. This is indeed true for our government's flagship program called Kalusugan Pangkalahatan, which aims to improve as well as to make sure that access to healthcare to our people, especially is even better. And thank you very much.
Tulay sa Kalusugan aims to support the Philippines towards achieving Kalusugang Pangkalahatan. In harmony with and in support to existing and planned service and drug packages, the project aims to offer affordable, innovative medicines. We believe that this is a major step forward in covering a wider segment of the underserved population with health services that otherwise would not be accessible. Tulay sa Kalusugan, a bridge of hope for marginalized Filipinos in Palawan.